Welcome back to The Science of Skin, United Beyond the Surface. Please welcome back Dr. Seemal Desai, Clinical Assistant Professor in the Department of Dermatology at the University of Texas Southern Medical.
Welcome to our next session, Working Together When Patients Truly Need from their healthcare team. I'm Dr. Seemal Desai once again. I'm a board-certified dermatologist in private and academic practice in Dallas, Texas, and the founder of Innovative Dermatology on faculty at the University of Texas Southwestern. And I am excited to be your moderator and host for this exciting session. And I got to tell you, I am super excited to be joined today by these amazing patients who are going to share their story. This is a really exciting summit, and I'm so thrilled that you all can be here with us today for the second part of today's exciting discussion. Before we dive in for the next 45 minutes or so into some really important and impactful dialogue, let's take a moment and introduce our fantastic panelists who are with us. You met the other board-certified dermatologists earlier today, and now I'm here with what I think is going to be a fantastic way to close out today's summit. And I'm going to allow our patients and caregivers to introduce themselves. We have Jasmine, Brenda, and Akilah. So welcome to all of you. We're so excited you're here. Thank you for joining me.
Thank you.
Jasmine, I'm going to start with you. Please introduce yourself to our audience.
Yeah, thank you so much, Dr. Desai, for the introduction. I'm really excited to be here. My name is Jasmine Ivana Espy, and I am a journalist, a filmmaker, an HS advocate, and the founder of My Gold Lining Inc., which is a nonprofit for HS. I have been dealing with HS for nearly a decade. And the condition is a condition that it can be very debilitating, but it presents in areas like the armpits, the groin, the buttocks, and it can even present in areas that, you can see, like your legs or the outer part of your thigh, your ear. And it's a condition that disproportionately affects people of color. But Black women are one of the largest subgroups that are affected by the condition. And while I have been privileged to have access to healthcare throughout my journey, that has recently changed, which has made things a lot more complicated for me while dealing with this condition. I'm unable to see a lot of the specialists that I really need to see in order to take care of myself in the ways that I want to take care of myself. And so I'm realizing that I'm having to advocate for myself in ways that I didn't realize I would have to. And that brings me to exactly why I'm here today. My intention is to speak not only as an HS advocate, but to talk about some of the ways that you can advocate for yourself inside and outside of the doctor's office. I've always wondered how many people are walking around affected by HS and afraid of what they're dealing with. And so it has inspired me to become an advocate and to essentially not only speak for the HS community as a whole, but also people of color, because I'm a Black woman. So I think that's very important for me, especially because Black people are 3 times more likely to develop the disease and go years without a proper diagnosis. So that's why I'm here, and that's why I'm happy to have this conversation.
Okay, so I told you were in for a treat, and I mean, this is exciting.
Yes.
Because you're saying all these amazing things that, for me as a board-certified dermatologist who treats so many HS patients, you're speaking for all of them. So thank you for introducing yourself and really sharing that impactful dialogue. Brenda, welcome. It's great to have you.
Thank you.
Please introduce yourself to our audience and tell us about your journey.
I am Brenda, and I have been living with psoriasis and psoriatic arthritis since I was 12 years old. And my case was a little funny. Usually you develop arthritis about 10 years after the onset of psoriasis. Mine came about 6 months later. So I went through my teen years having to deal with plaque psoriasis as well as growing pains in my body. I actually was okay in my teen years. I only had a few patches, but it wasn't until my early 20s when I went through the biggest flare I'd ever imagined going through. And it was that flare and coming out of that flare is what really changed and shaped my life. before that, I didn't really know what psoriasis was or what it did or, how it affected me, things like that. I just know that I had patches on my skin and I go to the doctor. But after that gigantic flare, I decided to research psoriasis. I wanted to find out more about it because I didn't want to go back to that spot ever again. And that was mid 2000s. And that's when I decided I joined the National Psoriasis Foundation. And that's when I became an advocate, not just for myself, but for other young patients that unfortunately, I didn't have access to. Everyone who I knew had psoriasis was older than me by at least 10 or 12 years. So as a teenager, I didn't have anyone. So when I found the Psoriasis Foundation and was given opportunities to be an advocate, I felt that that was an emotional cure for me. I grew from advocacy. I grew from and healed myself from trying to help others so they wouldn't feel the way I felt. So that's why I'm so happy to be here. And plus, these ladies are amazing.
They are amazing,
Oh, yeah.
and you're amazing for sharing your
you.
story. I wish everyone in our audience was here with us because the enthusiasm and the energy is palpable. So thank you for sharing that. And Akilah, welcome to you. And your story is very unique. So please share with us a little bit about yourself and your
Yes.
journey in dermatology.
Yes, so I have a 15-year-old son who has been suffering from atopic dermatitis, also known as eczema, since he was a few months old. He's 15 years old now, and I would say that the main reason why I'm here is not just because of our journey, and our journey was arduous, it had plenty of obstacles. When I say my son suffered not only physical symptoms, but he suffered emotionally, he suffered mentally, and not only has he suffered, but me as a parent and caregiver, constantly feeling the thoughts of inadequacy because I didn't have the answers. I couldn't cure my child. Typically when he cries, I come and ease him and comfort him, and I couldn't do that this time. So you can't imagine how guilty you feel as a parent. And I never wanted another parent to go through what I went through. And that's the main reason why I chose to be an advocate, not for myself as a parent, for my child, and for other people out there, especially parents and children of color who may not have that voice, may feel unheard, unseen. And so I took steps, not only through research, tons of research, and also asking 50 million questions to every clinician, provider I could possibly think of. But I also became a brand ambassador for the National Eczema Association, and they gave me wonderful opportunities and continue to give me wonderful opportunities to not only be a part of a huge, warm and loving community, but also be able to outreach to other parents. I'm also a group leader for eczema support for the Global Parents of Eczema Research. They're a grassroots nonprofit, parent-run organization that is amazing in terms of the support that they give for families. Not like myself, even as a parent of a child of color, amazing organization. And I'm just happy to be here to be able to share my story, to share my voice so that I hopefully can inspire someone else.
I absolutely love that message. And I think what you said is very, very important because you bring up the point which we talked about in the panel earlier. Skin disease just doesn't affect the patient. It affects the whole family. And I'm sure all of you have experienced that in your journey with hidradenitis suppurativa, with psoriasis and psoriatic arthritis, and with atopic dermatitis. And I really liked what you said about you as a mom, how you felt so challenged taking care of your child. You know, I'm a board-certified dermatologist with 2 young children. My 7-year-old son also has eczema.
Oh, wow.
Now, as a dermatologist, I know what to do,
Right.
and even then it can be a challenge for me. So when I see a parent who doesn't have that medical knowledge or some of the things you dealt with, you know, that sets them up for even a little bit more of a really challenging journey. So I really appreciate you saying that. We're going to dive into that in just a few minutes. So I can tell you, you're listening to three amazing women with three amazing skincare stories. So let's talk a little bit further. Jasmine, I'm going to start back with you. Not that we're going to go in order, but I'm going to start with you. You mentioned that you suffered for a long time with hidradenitis suppurativa, and you went a long time without proper diagnosis and treatment. So share with me maybe a time point or somewhere in your hidradenitis suppurativa journey where you sort of had that realization and you realized how important it was to have an advocate.
Yeah, absolutely. I recently was in the process of undergoing a procedure to reverse another procedure that I had for HS. And this was during a time where, the first procedure was during a time where I was extremely desperate to find relief from my condition. And unfortunately, there were red flags and things that I did not see and pay attention to that I should have within the process. And I think a part of that was because I didn't have an advocate in the room with me. And so this second time around, I really slowed down and I didn't think from a place of of being desperate. So I said, what do I need to do? And one of the things I realized I needed to do was have an advocate in the room with me. And so I asked the physicians that I was working with if my mother could join me virtually, because she lives in Detroit, I live in Los Angeles. And so they were very on board with the experience. And so we did all of this virtually. And my mom has been a part of every aspect of my journey. She's seen me at every stage. She's changed my bandages. She's seen me cry. I've cried in her arms, like everything.
Amazing.
And so this process really made me realize that having her was powerful, because she was able to ask questions that I didn't think of. She was able to say things that, I wasn't in the mindset to say for myself or to advocate for myself. And so I think that while I didn't go through with the procedure, moments like this have transformed the way that I do show up in the doctor's office for myself, and even outside of the office, honestly. I see the importance of working with healthcare professionals who care about me and listen to me and do everything that in their power to make sure that I'm getting the best care possible for myself. So that's what has solidified the importance of having an advocate in the room with me, honestly.
Wow.
Yeah.
And thanks for sharing the piece about your mom.
Yeah.
That's very important. And having that community to support you on your journey, especially with the disease like hidradenitis suppurativa that goes undiagnosed for so long. A lot of times patients come in to see me who have that and say, oh, I was just told these are boils, or these were heat bumps, or, I've suffered with this for years. I didn't know it had a name. I just figured it was just acne. So it's important that you had someone asking the questions for you. And all of you, when you introduced yourselves, mentioned the word advocate. And this morning in the physician panel earlier, I talked about the importance of advocacy. So Akilah, for you, as a mom, as a caregiver, you had to advocate not only for your son, but for yourself as his caregiver.
Correct.
Tell me a little bit about how important that was for you and what your experience was.
I would say that initially, me being a former sufferer of eczema as a young child, I had my mother there with me, asking those tough questions, sometimes challenging to a benefit and a fault. And I think that experience empowered me to a certain extent in terms of going into that room, into that exam room with my son, and being able to talk to our provider and say, listen, I know that this is not sustainable. I need something more, and being able to build that relationship. And it wasn't always like that, I know there were times where I felt like maybe I offended my healthcare provider by asking too many questions. Sometimes I felt like me coming in with research and being able to expound big words, medical terms, kind of made it challenging initially. But I think that through my journey, I learned that it was important to be able to establish that strong relationship with my healthcare providers and make sure that they know that I'm not going to leave this room until you understand I need to do this for my child. You aren't there when he's screaming at the top of his lungs because he doesn't want to take a shower because water feels like acid. You're not there cleaning blood-stained sheets and sheets riddled with dry skin. You're not there when he's sitting there and he's talking about he doesn't want to be present on this earth anymore. That's extremely challenging for any parent, especially a parent of a young child.
Absolutely.
So that in itself gave me superhuman strength in terms of trying to make sure that I'm there, and I'm grateful and thankful that I had a strong support system, including my mom.
I'm sensing the superhuman in you already, Akilah, so I can see that. I can totally see that. And your son is clearly lucky to have you. Thank you very much for sharing that, because I think the caregiver component of you not being not only an amazing mom, but also an advocate now through the Eczema Association.
Yes.
And now you're helping other caregivers and patients. I mean, you're inspiring me, and I'm a dermatologist with a son who has eczema as well. Probably not as severe as what you're describing,
Right.
but it doesn't always have to be the worst case of the disease. It can be your disease that affects you.
Exactly.
And I think when you're talking to me right now, I'm just thinking, okay, next eczema patient who comes to see me, I really need to get them involved with the Eczema Association, because I
Yes.
think for parents that's a great resource, just like the National Psoriasis Foundation and the HS Foundation that Jasmine, you mentioned earlier. So Brenda, you've suffered from psoriasis and psoriatic arthritis. And for those of you tuning in, psoriatic arthritis is when you can actually get psoriasis disease in your joints. And that leads to extreme pain. It can oftentimes be debilitating. You wake up stiff, you go to bed stiff.
You have deformities.
You have
things.
joint deformities. You can't oftentimes do physical
Yeah.
activities. I've had many psoriatic arthritis patients who stop working, who aren't able to maintain relationships because
Absolutely.
they become very sedentary in their
Yes.
lifestyles. Talk to us a little bit about your own experience and your journey as an advocate.
Sure. So I was diagnosed, like I said, at 12 years old for psoriasis. The psoriatic arthritis, I've already had the disease present. I just wasn't fully diagnosed until my early 20s. But I did feel the pain of it along with my skin. And I played sports in high school. So I was actually allowed to wear like long sleeves and tights underneath my uniform. So that was really nice. That was the one thing that I was really worried about. Little did I know that I kind of wish now I had the psoriasis I had in my teens, because it's nothing compared to what I had to deal with in my very early 20s. I talked about a very big flare I had. So when I was about 21 years old, I was completely flared up from the top of my head to the bottom of my feet with erythrodermic psoriasis.
Wow.
And erythrodermic psoriasis, for those who don't know, is a very dangerous form of psoriasis where your body, literally you look like a lobster. Like you look like a cooked lobster, and your body no longer has an ability to regulate its temperature. So at that point, I was in and out of the ER 3 times in 3 weeks. I could barely eat. I was also wheelchair bound and bedridden. So if I was not in bed, I was in the wheelchair. And it was the darkest time of my life. Being 21, 22 years old, you're supposed to be out clubbing. You're supposed to be wearing 6-inch heels and enjoying your senior year of college. But I had to leave school because I could no longer function as a human. Like I couldn't get up out of bed without crying in pain. And I know Akilah knows what I'm talking about, because her son, I actually went through very similar experiences what her son did. And for me, it got so dark that I also didn't want to be here. And now that I think about it, like who I am now today compared to who I was at 21 years old, we obviously change. But I was able, through advocacy, through volunteering, all those things, and I was able to finally, in a way, heal that part, that emotional part that had been so broken since I was 12 years old, and didn't know that, because at 12, that's when you're developing your emotions, your everything. So for me, that was the darkest part, and what really snapped me was my dad. I'm a daddy's girl. But my dad was who snapped me out, because at my darkest point, he was just tearing up, and he is my very strong, stoic Asian father. And to see him just bawling for me, it was such an eye-opening experience for me, because I've never seen that ever. And for us as immigrants to this country at the time, they didn't speak very much English. So when we went to the doctor, it was more like they would give us, a form of care, and then we would use it. But for them, it was really hard, because there is no word for psoriasis in our language. They call psoriasis psoriasis. There's no word for it. And they didn't really know how to ask or advocate for more for me. And they also didn't understand chronic. Like, how is it that we're going to the doctor once every 2 to 3 months, but you're not better?
You're not getting better.
You're worse now. Like, what is happening? So that was a really hard part. And after that happened, I started researching psoriasis. I went whatever search engine was there at the time, and that's how I found the National Psoriasis Foundation. And I joined their foundation. I spoke to other members, and I actually went to my first conference that, like, 2 months later, just so I could be around others. And I think that was the first time I was actually surrounded with people who had my condition, who not only sympathize but empathize. Exactly. Yeah. So that was that very first, and that's when it changed for me. That's when I'm like, I don't ever want to feel 21-year-old me ever again.
Right.
So.
Wow. And I really appreciate you sharing all of your experiences, not only as someone who clearly suffered a lot, but also that time course. And I'm glad you mentioned the word chronic, because all of you have experienced diseases that are chronic.
Yeah.
And unfortunately, in dermatology, we don't have cures for a lot of these conditions. The beauty is now we have amazing treatments for hidradenitis suppurativa. We have biologic therapy.
Yeah.
Because I think right now, this year alone is really groundbreaking for a lot of what you all have experienced. And we'll get into that in just a couple minutes. Let's talk a little bit about something a little bit different. We talked about your own journeys. We talked about advocacy.
Yeah.
But let's talk a little bit about healthcare inequities. And as all of you as patients of color, as families of color, I'm a dermatologist of color, I treat patients of color, we know that there are health inequities in the healthcare system. We know that systemic racism has existed in healthcare for many years and has negatively impacted, marginalized communities.
Yeah.
So what I want to know is, have any of you ever felt discriminated against or unheard or unseen, especially with something like a skin disease, because of your background or because of your ethnicity or racial background? So, Akilah, let's start with you.
I would say that initially, with some of the providers that we selected, I did feel like as if I wasn't being heard as a caregiver. I didn't feel like, I felt like, unfortunately, I felt like they were treating me as if I were uneducated. I just feel like there's, and not just in any condition, not just in general, I feel like there is a lot of unconscious bias when it comes to people of color. My own personal self has experienced it.
Yeah, well, and I appreciate you sharing that, because the unheard piece is something that I think is very important.
Yeah.
And, I will admit, we see 40 to 45 patients in our clinic a day. Many of these patients have waited for months to get in, and you have a limited time with each patient.
Yeah.
And sometimes it is challenging. And so hearing this from you all is helpful to me, even, who does this and really is passionate about this, because there are probably times where the doctor could probably do better in trying to connect or just listening. And one of my mentors in medical school used to say, just let the patient talk, because they'll tell you everything.
Yeah.
And sometimes that gives you more insight than you immediately jumping to a conclusion or trying to diagnose and fix. We're fixers, but sometimes it's not just about fixing, it's about listening and really empathizing.
I think the whole person picture, the holistic approach would make things a lot easier.
Absolutely.
In terms of the patient or caregiver relationship with their provider.
Thank you very much, Akilah, because I think you hit on a few important high points. Brenda, what about you?
I I have been very lucky that I've only had 2 dermatologists. My first was amazing, and then he retired, and now I'm with his protege. So the doctors themselves were wonderful because they're both men of color. Sometimes I would have issues with some of the other staffing, and there are things when I was doing light treatment, or if I was doing PUVA, which is also, Sorilin, and then you're soaking, and then you go into light. Sometimes I would ask questions, and because my skin is reacting a different way, I started getting hypopigmentation, and I wasn't used to that.
Yeah.
So I'm kind of like, what's going on here? Like, what is this? And they couldn't really explain it. And it kind of made me feel like, don't any of your other patients get this? Or is it just more noticeable on my skin because I'm so dark? Yeah. Like, which one is it? So little things like that. But the worst part is when I would go to a regular doctor, or if I was in an emergency situation and I'm being seen for, ABC, but then they're looking at my psoriasis and they're like, what's this on your leg? What's this on your scalp? Like, what do we do with this? And I'm like, but I'm not here for this. I'm here for this. And it just kind of felt like, well, let's try this and this. I'm like, but I'm not, you're not my doctor. I'm not looking for that from you. And it was really hard for those who weren't in dermatology to understand, and even those who are in dermatology, they weren't used to, I guess, the questions that I was asking. One of the other things that it was a misstep on their part, but because I'm so dark, they figured I could take a lot of light. So they started me on a very high dosage of light, and I completely burned, and I never burned before in my entire life, so I didn't know what that was like. So it was like little things like that. Instead of starting me slowly as if I were a lighter skin person, they kind of like, oh, we can go from instead of level 1, we'll go to level 3 because we think you can take it. But level 3 was way too much for me at that point. I grew to tolerate it later on as we continued treatment, but it was one of the things that made me go, I was very sensitive at the time, so it stuck in my mind. And now the staffing is wonderful, don't get me wrong. They're wonderful, but it was just like little tiny missteps here and there that made me go, okay, I am not patient ABC, I am patient Brenda. Right. And patient Brenda, her skin may be darker, but can we,
There's something that you said. You said that they would, if you were lighter skinned, they would go to the lower setting.
Right, because
you were darker skinned,
I could probably absorb more light.
That right there tells you a lot about that unconscious bias.
And it was just one nurse. It wasn't the entire office, but it was that particular nurse.
It left an imprint.
Exactly, yeah.
And it's just as she said that right there.
And this was how many years ago? This was a long
when
time.
I first started,
right. So,
yeah.
But these sort of things in a patient journey make an impact. It's the small things, and I think for healthcare providers that's important to know. Jasmine, a final thought on this question for you. Tell me a little bit about your experience.
Yeah, I had a similar experience to Akilah, actually. In 2017, a moment that sticks out to me is I had a very debilitating abscess in the perineum area region, and I couldn't walk, I couldn't eat, I couldn't sleep. Like, everything was completely difficult. I couldn't sit up like I am now. Like, it was extremely difficult, or I had to lean to the side. It was excruciating, and so I had to wait until the abscess came to a head in order to go to the doctors and get it lanced. And so I made an appointment. I went in, I hobbled my way to the office, even had a lady stop me at the door, and she was older than me, and she was just like, God bless your heart, because she saw I was in pain. I was literally, I was literally debilitated. And so when I went into the office, I got it lanced, and there was a suggestion from the nurse who was there to go home and treat it in a certain way. And it didn't sit right with me just because I was uncomfortable with it. And so I asked for an alternative to what they suggested. And so the nurse looked at me with a very cold and, just sort of a cold and sterile tone. And she said, if you don't do this, you will get another abscess. And so I was sitting in a pool of my own blood and pus and things like that. And I was in tears, and I could not, I'm a very strong-minded person, But when I'm debilitated, I can't think right. I couldn't think right at that moment. So I couldn't advocate for myself. And so I was just like, this is a very, it was a very jarring experience, but I think the saving grace of that moment was the physician. I was able to talk to her, and she worked with me where the nurse necessarily didn't want to work with my suggestions. And so that made me feel seen and heard, even though the nurse didn't see and hear me in that moment. And now I know that goes back to the whole advocacy, part. I wish I had my mom in the room or my dad in the room, because that would have been a whole different conversation. But now I know that I need to work with physicians, nurses, a team that is not only trying to treat me, but is also empathetic towards my situation.
That's a great point.
Yeah.
Yeah, the empathy piece is so important, and you can feel that from all of you. I mean, you all are obviously very empathetic yourselves, otherwise you wouldn't be here sharing your stories so openly. But the empathy piece is really, really important, and that does definitely sound like an experience. You'll never forget that. No. You obviously are impacted by that. You can talk about it, but it still weighs on you, and I can tell that. You can feel that.
Yeah.
Let's switch gears a little bit. Let's talk a little. We talked about inequities and we talked about advocating. How about thinking about your own skin condition online or in social media or on TV or in print or in digital? Have any of you now, or where you're sitting now, or potentially in the past, ever found it difficult to find representation of your own skin to make you feel like you can relate? Or seeing that online or in print? Brenda, why don't I start with you?
Yeah, so when I first decided to research psoriasis for myself, I used whatever search engine was at the time. And I remember putting in celebrity with psoriasis or celebrity psoriasis skin or just something like that, just to see, who would show up. And the funny thing was, it took me to a very spicy site that featured, I guess, videos with psoriasis on it, and I just went, wow, okay. So I changed that site right away. But but the funny thing is, some of the people who were coming up were older celebrities that I didn't relate to. I didn't watch their things, or I didn't really know who they were. I couldn't really relate to any of them. Now it's a completely different story. We have so many celebrities and so many medical influencers on different forms of social media. So you see the representation more, and I like that more, especially since we think my niece might possibly be starting a little bit of psoriasis. And I'm so glad that she now has so many women of color, to help understand that what she's going through or may possibly go through is not abnormal for us. I felt it was more abnormal for me because, especially when I went to my first conference, I don't remember meeting too many who looked like me. I think at the time there was, someone else of Asian descent, but they were of lighter skin. So when we were talking about treatment, it was completely different, things of that nature. Now I'm really glad for the representation. I think it's wonderful.
And it's funny that you mentioned some of the way you felt that sort of visceral reaction, and I bet some of you have had that. Jasmine, tell me about your experience or thoughts.
Yeah, I developed HS when I was 11 years old, and so at that time I had access to the internet. My dad worked for a company and everything like that, and so I was looking online for representations of what my condition would look like in the future, because I had severe HS all over my body, and there was scar tissue and everything. Still have that, and I didn't see a lot of black skin at that time. I don't even recall seeing any. And while that has gotten better and has improved, it's definitely not where it should be. There are a lot of European representations of HS, and that's at every stage, every level. And I think the same thing needs to happen for black skin. And so what I have done, because I'm a journalist and a filmmaker, is that I took it upon myself to use the things that I've done in school to help shine a light on that. So I created a documentary on HS, highlighting the experiences of Black women with HS.
Wow.
And that pivoted into me being able to start a nonprofit that not only services African Americans, but the HS community as a whole, with the goal of educating and being a space where patients can find solace and find their voice and express their stories. And so my documentary is more than a passion project. It's something that I hope is ingrained in HS history, and is really a catalyst for other people of color and people who don't look like me to use their voices in ways that they never thought they could. And then I also want it to be an educational piece for healthcare providers like yourself to understand how you can treat Black patients with HS, and then also just like what we go through on a everyday basis outside of the office. And yeah, that was the goal.
So with this documentary, I have to watch it, but I see an Oscar in your future. Okay,
I see it too.
We knew
with
her
a
when.
filmmaker. So this is something we all have to remember. We will remember this when you
Yes.
introduce. But that's really amazing, and thank you for sharing that.
Thank you.
Akilah?
Well, it's so funny you said that. The other day, I was talking to my son, and obviously, you know, he's considered a Z-Gen. So he's very much internet, all those different social media platforms. And I asked him, I said, are there any other people that look like you that have eczema? And he said, no, actually, no. And I Googled it, and he was right. I did not see not one black boy, Black man with eczema. And I think the only person that stands out is Brad Pitt. But everyone knows that, right? And but it was just so funny that, you know, there is no representation. There is no one that looks like him. He, you know, a lot of people, even Googling just to see what eczema looks like on Black skin is quite hard. It definitely wasn't something that happened. If you did that 5 years ago, 10 years ago, there was no such thing. And so it's just really interesting that as long as this condition's been around, and it's, you know, a lot of people, Black people are disproportionately, you know, affected by it, that we don't have a plethora of skin tones represented on what it looks like. And that makes me pause, because if there's no representation in terms of how it presents on different shades of brown skin, then how do dermatologists or pediatricians, primary care physicians know what it looks like?
Right.
That right there.
Well, you bring up a great point, and that's why it's really incredible that organizations like the Skin of Color Society that we talked about, we've been doing that. In full disclosure, I'm a past president of that group, and that's a big passion of mine, is that public-facing education. How do we educate you all as the patients? But even more importantly, you all know what to ask, because this is what you do. But what about those suffering out there who don't even know what the name of this skin condition is and how to get to a dermatologist? So I really appreciate you all touching on that. Now, we have lots of questions coming in, and we're gonna get to some of those in just a few minutes. But let's talk a little bit about some of these things that patients do to hide their own skin. You know, you all mentioned that about stigma, how you felt marginalized, your son felt marginalized. Do you think that's true for everybody, or what kind of comments have you all received from people about your skin? Akilah?
Well,
or your son's skin in your case?
I would say that even when I had eczema, I covered up. I made my own self uncomfortable, and I would say he does the same. He's walked around with hoodies and sweatpants in 90+ degree weather. And I would ask them, are you comfortable? He was like, well, actually it makes my skin feel better. I don't feel right going out there and sweating profusely, and then the sun's beating down on me and I start to itch. I get irritated. So it just makes it feel better that I walk around uncomfortable, hot, because he doesn't want to, he wants to feel more comfortable, but also he wants no one to sit there and talk about him or ask him, why do you have bumps all over your hands?
Exactly.
Where all those marks come from? Or keep people that he may hang around socially to not talk behind his back. I mean, like, you know, you're talking about adolescents here. You're talking about kids that are forming their own, brains still developing, still trying to learn to socialize, especially coming out of a pandemic. And then you have this here, a kid trying to deal with a chronic condition and people not understanding it is not just a rash. Mm-hmm. It is not just dry skin.
You're not contagious.
You're not contagious.
Yes.
How many times kids have, when he was younger, they didn't want to play with him because they thought they, and even parents.
Exactly.
Thinking that he was contagious. So, you know, that's the thing, like education I think is absolutely key, not just for eczema, for anything, because, you know, people just don't know. Mm-hmm. And people, you know, even now think, like I said, it's just a rash. It'll be okay. Just put something on it. Just put some lotion on it. It'll be okay.
Yeah.
And not thinking about how difficult and how chronic this condition can really be.
Yeah.
And how it's not just physical. Like I said earlier, it's emotional, it's mental. It affects so many different people within that support group, within that family, within that nucleus. So, yeah.
And you don't want to minimalize it
and
make it seem small. Absolutely.
Right.
You know, and I practice in Dallas where yesterday was 105 degrees. Mm-hmm. And I see that. I see my eczema and psoriasis and even HS patients wearing big, long jumpsuits because they don't want to be sitting in my waiting room waiting to see me and other patients looking at them. And it's incredibly challenging when you experience that. So I'm glad you brought that up. Really, really important. So thank you for sharing that because I know that's very personal for your son as well. Brenda? Could you share some of your thoughts?
So I'm a big fan of the sweatshirt. I wore sweatshirts throughout junior high, especially when my skin started, was actually the beginning of junior high. Unfortunately for my scalp, because I had really bad scalp psoriasis, it was really hard to hide it. So I used to like put my hair in a bun, but make the bun really loose so you kind of hide the scalp part. I had more hair then, so it was a little easier. But there used to be a joke with my friends in school. It was like, how many sweatshirts do you have? And I'm like, I have 30, one for every single day. But honestly, it kept, like if I were to scratch, because I was a scratcher then, it kind of held the flakes in so I wasn't flaking everywhere. And I think that was, you know, when you're trying to be a teenager, that was very important for me. Nowadays, I'm much more comfortable in my skin. I don't mind swimming if I have plaques. I won't swim in a chlorine pool, but, you know, I will swim in like the ocean or anything like that. I don't mind who sees my skin now. But it also took me until my mid-30s to feel that way. And it took years of advocating and years of talking and having others, you know, remind me, it's just your skin, it's okay. Like, let's get some sun on it. We got to get some vitamin D on this. So that really changed, but it took so long to kind of get out the idea. And I actually wore a really nice dress a few years ago, and it was a shorter dress, and my psoriasis was showing. And my mom was like, do you want that? Are you okay with this? Like, and I'm like, yeah, it's okay. But she was more worried about what others would say to me versus, you know, no, don't go out there like that. So it was a very big, like, conscious decision on her part to kind of cover me up also so I would be protected from the comments.
Right. Yeah, absolutely. And Jasmine, some final thoughts on this question from you?
Yeah, I do remember a moment, like, HS is a very complex condition, and like I was saying before, it can show up in places that are not easily covered, like your ears, your head. I remember I was in a shop at a store trying on clothes. It was my father's friend, and I don't have a problem showing my scars anymore, and I have some that are on my chest that are visible. And she saw the scars, and so she asked if I was a breast cancer survivor, and that was jarring for me because I was just like, first of all, I didn't realize, because I'm so comfortable with it, I don't recognize when people recognize it.
Right.
So when she pointed it out, I was just like, I became suddenly embarrassed. And so I used it as a moment to just like educate her. But I don't think every patient has to do something like that, because it can be very taxing. But I just used it as an opportunity for myself because that was a way for me to take back my power and my agency over my experience, you know?
Wow.
Yeah.
Really impactful. And like you said, you were already comfortable with it, and that almost sort of brought you back down in a way.
Exactly.
Wow. So thank you all for sharing that, because I think that advocacy piece and what you can do is really, really so important. So let's go ahead and move on, because I think there's so much that we've dived into here, and we have so much great information. So let's kind of bring this together. What can we do, and what advice do you have to help patients, especially patients of color, advocate for themselves? And Jasmine, we started with this, so why don't you kick us off?
Yeah, I mean, I would say, have someone in the exam room. Like I was saying before, an advocate is very, very important. And I would also suggest channeling that energy that you have, because HS is a very not only physical condition, but it's an emotional condition as well. And so there are ways to channel that energy into whether it be art, social media, and even if you can't do that, because that can be a lot, even speaking to your family members or your friends about your experience, and letting someone come into your experience to support you. And of course, you have to vet these individuals, because you never know, and you might come against somebody who doesn't want to support you. But that doesn't mean that you're not worth supporting. And so I just think it's important to have a voice, just because big or small, speaking up matters.
Speaking up definitely matters. Brenda, what advice can you give us?
I agree with speaking up.
I figured you would. I know you all are passionate.
Honestly, for me, it was finding the right doctor, because you can't have success unless you have the right team behind you and the right support system, be it family, your doctor, your nurses, your care team. I think a lot of patients, especially the older like my parents' generation, when I've never needed to change a derm, fortunately, but I've advised others that if they were not happy, then to look for another derm and to change the derm. But you also want to be not just someone who would listen to you. For me, I wanted someone progressive who was willing to, explore different care methods for me and with me. And I am so lucky that I have an amazing derm who I will literally go into an appointment with him with a list of things that I want to discuss, whether it be, hey, this happened on this day. What is this? What could this possibly be? Or I've heard about this particular care. What do you think of it? Like, do you think it would work for me? Things like that. And then we actually sit there and have a discussion versus him saying, okay, Brenda, this is what we're going to do, A, B, C. And you come back in 4 months and tell me if it worked, things like that. So that was the biggest shift, was when I stopped looking at the doctor for instructions and started being a part of the team for my care.
I like that. I like that. Yes.
So, and when I did that and I took over my care, I think that's when mentally, physically, emotionally, everything got better. It came together.
It came together for you.
Yeah. So that is the biggest. Your team is number one, but you are even higher than that team. You lead the team. So, and I know it's hard for doctors, but
sometimes it's hard. But you're making a great point. You're being your own champion.
Yes. Exactly. You lead them to what you want, and if you find something that maybe you want to try and they don't think so, you come to a common ground. Yeah. But it's finding a doctor that's willing to listen to you and willing to explore those things with you. That's the most important. Because if they just shut it down, I don't want anything to do with them.
Right. Very, very insightful. And Akilah, what about you?
I would agree with everything that Jasmine and Brenda said. Because equally on top of that, not just being able to speak up for yourself, not just being able to have a wonderful, supportive team, you as the patient, as the caregiver, must walk into that exam room armed with information. You cannot, even if you might think it may be this, you may think it may be that, I would make sure that you do your research. I would do as much research as you possibly can on what you might think it is. And also, don't say yes just because that's what they say. There could be some alternative that maybe they have in their back pocket. Or maybe there's something that they might not have thought of, and then it pops into view. Oh my gosh, wait a minute. Maybe we'll try this. I mean, that has happened to me, where, they wanted to do something, prescribed a specific care treatment that I didn't agree with.
Yeah.
I even asked them, would you do that? Would you give this to your child? If you wouldn't give this to your child, don't ask me to.
Right.
So that's what I'm saying. Speak up and make sure that you establish what your expectations are in terms of that partnership. Because I feel like if I'm going to be an advocate for myself, if I'm going to be an advocate for my child, that my doctor needs to be an advocate for me too. Mm-hmm. We're in this together.
Right. It's that team again that
It's
Brenda
the
referred.
team. It's
But
the
I'm
team.
glad you mentioned the redo your research, because all of these organizations like the Eczema Association, like the NPF, the HS Foundation, those are places to go get some amazing information. Not everything you read online is true, as we all know,
Correct.
but these groups are great resources, so I think that's fantastic. So our last question today, in the last few minutes, I mean, we could talk for hours,
Yes.
right? I mean, this has been, we could talk for hours. This has been amazing. But before we go into the audience Q&A, we have a lot of questions coming in. We're going to try to get to as many of them. But what do you wish all physicians or healthcare professionals would know when working with patients of color? So I'm going to give you a soundbite moment to tell us that, because I'm going to take this in and think about it when I get back into my practice. Brenda.
Oh, gosh.
You get to go first.
Honestly, I think the biggest thing I can say is I am not patient ABC or XYZ. I am not, the case study. I am patient Brenda. And my experience and my journey with care and my flares and the way my body reacts to, all things is different from someone else who may suffer from psoriasis and psoriatic arthritis. And I think I wouldn't want to walk into a situation where it's like, okay, we're going to give you this, and if this doesn't work, then we'll give you this. And that's like the order in which you do things. And I think for me, it was more like, okay, that's a great idea, but can we jump to something more progressive or, for me? So that was my biggest takeaway, I think, is, yeah.
I love that. Akilah?
I would say that I would hope that all clinicians would go into, when you're treating a patient of color, to think of it as not just treating the symptom. I would love for more clinicians, especially with patients of color, to be able to go in there and treat their patient, the whole entire patient. You're not only treating their symptoms, you're also empathizing with their caregiver or their support system that's in there that has been up all night crying because they don't know what to do. They feel inadequate. They feel like failures, like I had plenty of times. It would make so much more of a difference in terms of that relationship, that partnership, if there were more clinicians that thought of my child and me as not just a date of birth in a folder.
Right.
That you think about not just his symptoms. You think about when you pull him into the exam room, you ask him, how are you doing? How are you really doing?
Right.
How do you feel? How's school? Those things, taking into account all of these different things, because, like I said, this condition is chronic and it is not just a rash. It is not just those bumps. It is not just the oozing skin. It is not just the dry skin. There is so much more behind this condition that I hope that more clinicians think about when they go into the treatment room, and not just, like you said,
The holistic
this
approach.
This is what's wrong with you. Take this and come back in 2 months, and it's over.
Yeah.
I think it would make things so much more easier, palatable for a patient or caregiver to not only be able to trust what you're saying, to be able to be transparent in that moment and say, listen, I don't know what could work. I'm not going to promise you, these things.
We can work together.
We can work together.
Yeah, I love that. I think that's, and you all have kind of resonated that same theme. Jasmine, I know you agree with them because we're all singing the same tune.
Absolutely.
But your final thought.
Yeah, the only thing that I would add is that I really wish doctors, dermatologists, clinicians would familiarize themselves with how dermatological diseases present on Black skin.
Yeah.
I really feel like it's not just enough to, and we were talking about this the other day, not enough to have Black patients or have people of color that you
Yes.
treat, but knowing specifically how to treat that skin is important.
Yes.
Because that makes me feel like you care about me, and that makes me feel like I'm under the best care that I could possibly have. And I think that that would make, honestly, the world of a difference.
That training and education.
Yes.
I'm glad you
I agree.
mentioned that because you each touched on a different point. So let's move in our last few minutes. Like I said, we have lots of questions. We won't be able to get to them all, but we're going to try. And I really want to thank, first of all, each and every one of you for sharing these insights. One of the important things that we've talked about today is all of the advocacy, being your own advocate, the education. And a lot of the questions coming in now really sort of reflect that. So we're going to go through these, and I'm going to kind of direct them each to one of you. And then if you think about it, just sound off your gut response. So I'm going to start and think about that healthcare provider piece, about taking that proactive approach to understanding needs of patients of color. So Brenda, what do you think about that?
You know, it's funny with psoriasis, there's such a stigma around it, but there's even a bigger stigma in the Asian community surrounding going to doctors and trusting. And it's funny because a lot of my friends don't normally speak about medical things. I think I'm honestly like the only one who's done so and who's been very open about her medical journey. And I think understanding, a patient from my background of my particular set, that, that is a big part of it, is breaking that stigma that it's okay to go to your doctor and it's okay to speak to them about this, and it's not something that you need to hide within the family. And that happens a lot in Asian communities, unfortunately. And for doctors, I want them to understand that that is a part of the culture. That is a very big part of the culture, and they might not be too forthcoming, like, going in for, something and then just not telling the full story.
The full picture.
Because you don't want them to say, oh, this is what's wrong with you. Let's, there's a kind of a stigma against like starting full-on treatment. It's actually really interesting. So for doctors to understand that there are times when patients will have the care treatment and not actually utilize it because they don't necessarily trust the doctor themselves or trust the, the particular form of care or, something like that. But there's some kind of stigma in there. And I think that's a big part of understanding how to treat, a patient from my background.
Very, very important. Jasmine, we have a question for you about the pain associated with hidradenitis suppurativa. Any tips on how you cope with that?
Yeah, as I was saying before, I'm a very creative person, so artistic expression is huge for me. As you can tell by my outfit, I like to be seen, I like to be heard, I like to be felt, but it wasn't always like that. Artistic expression really helped me to come out of my shell from, producing the documentary to doing poetry to doing, expressing myself online. There are different ways that you can express yourself and transmute the energy and the experiences that you have. And it allows for people who don't know about your condition to come on board and support you. And like I was saying before, there might be instances where people are not open to it because posting things on social media also opens yourself up for hate and ignorance. However, when you have a group of people who can support you, that stuff is just noise in the background. You know what I mean?
So important. That's really important. And those are great coping strategies like you share. You're expressive, you're out there, you're sharing. And that's a really important point. Akilah, we had a question come in for you. You mentioned atopic dermatitis, the community.
Yes.
Where can people find resources for that, for atopic dermatitis?
Well, I could say that probably the biggest resource out there is the National Eczema Association. I know I've said that multiple times.
But that's important. No, remind our viewers.
Their resources are extremely helpful to patients, young and old, caregivers. They have a huge community of brand ambassadors, advocacy ambassadors. There are plenty of opportunities for education there. We do peer-reviewed medical journals. We do all kinds of things. And we're constantly in the forefront in terms of not just arming ourselves with education in terms of the actual condition, but also trying to make change, health policy change. They just did a huge virtual National Hill Day, which I was a part of, where
amazing.
Yes, where we got people, different public officials to sponsor the Care Step Act. They do such amazing work, and the community is so close-knit, even though it's quite large. There are quite a few people from all across the country, even some people that are overseas globally. So it's a great organization. Another good one for caregivers of young children with moderate to severe eczema, Global Parents of Eczema Research. Like I said, they're a parent nonprofit organization. When I say these parents turned advocates turned organizers are amazing people, and they have what I was a part of as well is a caregiver support group. I was a leader. We had parents come in, men and women, come in, and we had support groups. And it was so amazing to be able to share each other's journeys, share each other's stories, share each other's, and cry with one another, laugh with one another, share stories with one another. It was so empowering. It was so healing and therapeutic at the same time. And also, there's tons of information out there. Social media has scores of different groups based on severity, based on care regimens. There are all types of information out there. It's just a matter of, reaching out to the community. We're here with open arms.
Well, and I think that's a great note for us to end on. I mean, there are so many questions coming in. Like I said, we could really talk for hours. But I have to thank you all, because this has just been a phenomenal experience, not only for me as an expert, but also for someone as a physician and as a board-certified dermatologist and a leader in the medical field. To hear these stories again kind of level sets and puts things in perspective. And for you to share your hidradenitis suppurativa story, Jasmine, for you to share your psoriasis and psoriatic arthritis story, Brenda, and Akilah, for you to share the caregiver's perspective with atopic dermatitis. I can't thank you enough. This has just been phenomenal. And for all of you viewing in today, thank you for being a part of this Science of Skin Summit and sharing in our moment of letting these patients have their voice, because I think this is just the beginning of a great conversation. So with that, I'd like to turn it back over to Chudi Nduwaka, who I'm going to welcome back to the floor, who joined us to open this morning and who's going to give us some closing remarks. Chudi, over to you.
What an incredible discussion today. Thank you so much for joining us today, and thank you to our speakers. We hope this discussion on disparities across dermatology in care for patients of color was very educational for you. AbbVie is so grateful to the healthcare professionals, the patients, the advocates that were here as part of this session. Thank you to you all. AbbVie is committed to equity, equality, diversity, and inclusion. And as leaders in dermatology, we know we must lead by example to ensure that we're doing everything possible that we can to better serve all patients, including patients of color. As a reminder, this event program includes links to all the resources discussed today in today's session. If you have any questions, please follow up with us and reach out to our public affairs professionals. We hope that these sessions were informative for you as you consider the role of health equity. Together, we can be united beyond the surface as we challenge the norm and push for change within dermatologic care. Thank you, and see you next time.